I think if you ever meet Dr. Duggins, she is the most humble, down-to-earth, and one of the nicest persons I've ever met. I've been lucky to have mentored and worked with numerous students and residents from across the country, and I gotta say, she is a force to reckon with and probably an inspiration from a leadership perspective, from an involvement perspective, and what she has done for others.
I was interning in New Orleans, where this is a significant issue, and I realized that there was a huge gap in our training as medical students and future doctors on how to take care of and how to respond to people who might be trafficked. And so that was really my inspiration, but it really started because I have this basic principle that I apply for everyone, that everyone wants to be known and cared for. And I think with this particular patient population, that was really stirred in my heart that I wanted to do something to really bridge the gap of how they're taken care of and how they're even identified in the beginning.
She's trained over 2,000 people, not only just medical students, but physicians. She's also taught nurses and even our emergency medicine technicians here. So her goal is to just truly spread the word and educate and be able to provide trauma-informed care to anyone that gets to see and touch other, people's lives, survivors' lives.
Blue Heart Clinic is a clinic that serves survivors of domestic violence or human trafficking. And so I was very inspired by the idea of helping those who may not have had great experiences in healthcare in the past and trying to give them that better experience so they have more faith and trust in healthcare providers. That way they are able to get the care that they need in the future.
I think it's a topic that we don't hear about a lot and we don't get a lot of education on. So when I kind of saw the opportunity to get that education and was able to so quickly see kind of through those trainings how applicable this would be in my day-to-day practice and how much that could really benefit patients, I think it was just like you go to the trainings and it really opens your eyes to kind of all the things that are going on around you. And once you see that, you can't unsee it. And so getting to then go work with these organizations and volunteer and like apply those skills, hone them in so that I feel more comfortable in potentially scary situations, I think has been really valuable and keeps me coming back.
I used to tell my family if one person can be educated, if one patient can have a different experience, then it would be worth it for me. If you would have told me starting this 4 years ago that I would be where I am today, I think I would have laughed very nervously, like I don't have time to do all of this. It would have terrified me. All the things looking into the future, seeing all the things I would have had to do, I probably would have said no to the opportunity, but knowing that a few people have benefited from this, I do it again and again.